As the world looks and hopes to get to the other side of this coronavirus pandemic, there is another fight we may not be prepared for, the fight against our fears. One expert recently penned this piece in Politico. It calls the fear the next epidemic. I spoke with the author of that piece, Joshua Epstein, earlier today. He's a professor of epidemiology at New York University's School of Global Public Health. Professor, thank you so much for the time. You're the perfect person to talk about where we are now, but also for what the next phase of COVID will hold for us. But first, for the here and now, how concerned are you that even with the positive news, albeit couched with a lot of reservations, that we may be plateauing in some of the bigger cities right now, at least on the eastern seaboard, that by no means is trouble behind us, and the concerns that we reopen the country too prematurely with a lot of history to support those concerns could be around the corner if done wrong?
Yeah, this is a very serious problem. In the Spanish flu in 1918, which killed 50 million or so people worldwide, we prematurely lifted quarantine, social distancing in major cities of the United States and experienced second waves that were very severe here in the US, but also in the UK and elsewhere in Europe. So, yeah, there's a very serious possibility that if you lift distancing too soon, you'll pour susceptible people out onto the infected embers and the thing will reignite. You just have to be very, very patient and avoid that substantial risk.
And if you could, use the example of 1918 in Chicago specifically, because at the outset, their public health commissioner, or the equivalent of it, did the right thing, identified this as a real risk, unlike Philadelphia, which had the parade that we all know about. The commissioner said, hey guys, if you got a cough or a cold, stay home, stay in bed, and they listened to them, but unfortunately, they let them out too early, right?
Yeah, that's what happened. I mean, in 1918, we didn't have the sort of modern theory of epidemic dynamics, and it's understandable that a commissioner of health wouldn't know that even a few infecteds, if they're still out there, and you pour healthy people onto them, you'll get another wave. So they did the right thing at first, and fear was our friend at the beginning of the 1918 flu. But after a while, there aren't too many visible cases. There may have been asymptomatic cases who can still spread. And people, it's fatiguing. It's very exhausting to be locked away, as we all are learning. And under the circumstances, he made an understandable mistake.
It's interesting, Professor, when I looked at your piece, I didn't think, even though there's a lot of modeling, that the human emotion will be a huge component to this. And you talk about fear throughout your piece in a lot of different components as being a huge driver of what the outcome of this will be in the long run. Talk about what you describe as the four horsemen of the apocalyptic as it relates with COVID, and fear being the driver of them. Give the different stages to the audience.
Okay, all right. So there's one contagion is the disease itself. Another contagion is fear of the disease. And that, as I say, is very helpful when it encourages us to social distance. But fear also doesn't last forever. And when you're not exposed to the actual stimulus, the fear starts to evaporate. It starts to extinguish, in the words of modern cognitive science. And, if that happens too soon, then the thing can come back. The other horseman happens a little bit later when we have vaccine. I mean, again, there's fear of vaccine that actually can bring this back as well. In the 2009 swine flu pandemic, the World Health Organization, declared it was a global pandemic, and half of Americans didn't take the vaccine. Vaccine refusal is has brought resurgence of measles here and in Europe, which can be a deadly disease for children. WHO now ranks vaccine refusal as one of the top 10 global health threats. So another horseman of the apocalypse is going to be fear of the vaccine down the road. So, we have to combat that and get people to take this, assuming that it's safe and effective, which we're doing everything we can to ensure.
you also identify that leaders matter in this, in the obvious sense, but also maybe in ways we don't know. You identified in your piece Agent Zero that you talk about as Trump. We've seen governors take the point on this, certainly Governor Cuomo, Governor Newsom, Governor Hogan in Maryland. We can find others where they shoot straight with the public, tell them exactly where we are. They give them numbers every day. They talk about what we all need to do. And they also talk about the problems. And the more transparent, seemingly, at least to me, Professor, the more receptive the public is because they think they're being shot straight with. However, when you get to the president and that this is a hoax, it was going to disappear, and all the other things that I'm sure we're going to relitigate between now and November, it freaks out the markets and it freaks out the public when they don't know what's up and what's down. And I assume that's going to be something we're going to contend with here as the summer comes on us as to when do we start going back to normalcy? Who do we trust?
Yeah, I mean, this is a real problem. And again, you mentioned Agent Zero. I mean, I build models that we build software individuals that have the same decision apparatus as people, and at least we try to include things like fear. And the main finding that of this science is that the big driver of fear is surprise. And if you set people up with false expectations that things are going to go away miraculously and this sort of talk, then when they don't go away, the fear is even higher than it would have been otherwise. And the overreaction is higher, and the panic is higher, and the financial panic is higher. So, Trump's own dismissiveness about this thing set us up for the financial panic he cares most about. You got to shoot straight. You got to tell people the truth. That's all we can do in a situation like this. So, yeah, I mean, I think that's a real blunder, and we can't repeat it.
So the question is, and let's do it's an obvious hypothetical, Professor, but let's say you have a seat at the table and the president goes, okay, if you looked at your modeling, you looked at history, when do we tell people to go back to normal? And I ask that because we're already seeing what are supposed to be the gold standards in Singapore and other Asian countries that did it right, that did mass testing, that were pretty comfortable that they could reopen the country. Singapore's closing their schools for the first times, even after the first round of this. And we know in 1918 there was more than one major spike to it. When do we tell the public, and what conditions do you think have to be met before we say, go back to life as you knew it?
Okay, well, first of all, China, all these countries, I mean, they're running a natural experiment about the second wave, and we'll see how safe it turned out to be to let everyone back into circulation. One way to get people back to work safely is to do very broad-scale antibody testing, and people who are known to be immune can rejoin the labor force, and they can also be a supplemental healthcare workforce if there's another surge or if this surge continues. And I think that's a nice, sensible, gradual way to restart the economy as we flatten this curve, and that's a sensible way out.
I think that's a good way to end this. Professor, I really appreciate the time. Thank you so much.
Thank you very much.
When we come back, helping local hospitals, one worker's story, and our ongoing campaign. Please stay with us.